Hi, it's Dr. Tim Syed, MD, double board certified plastic surgeon. In this video, we'll talk very briefly about tummy tuck surgery and how we help patients determine if they're a good candidate for the operation and a few of the surgical principles. So the first thing to know is that tummy tuck surgery is the popular term for abdominoplasty, the medical term. There are three major components that we assess when planning a tummy tuck operation. The first of these is skin laxity or looseness. What we're looking at here is how much extra skin does the patient have and where is it distributed. Commonly, patients seeking tummy tuck surgery have either lost significant weight and are now left with an extra apron or loose tissue in the skin where they used to fill that out with more fat, or have gone through one or more pregnancies where the abdomen has been stretched and now the skin has lost some of its elasticity and is redundant and loose. Patients often complain of that sort of overhanging apron that they have to tuck into their undergarments to get properly fitted for clothes. So the skin laxity is something that is treated with removal of the extra skin, which is created by an incision in the lower abdomen where we remove that skin and sew it up to have a nice tight skin envelope. The second component is fat. So what we're looking for here is the distribution of fat in the central abdomen, the lower abdomen, and around the sides at the love handle area. That helps us determine if the patient needs to have liposuction in addition to removal of skin, or whether that's correctable by the removal of the lower abdominal tissue alone. The third part is muscle tightness. Frequently, patients who've had multiple pregnancies will have a loose abdomen where they've lost muscle tone. There may even be a separation of the rectus abdominis or the ab muscles from one another, with bulging in the central abdomen. When you put these factors together, that tends to lead to a very flabby looking tummy with extra skin, extra fat, and loose muscles. And particularly our female patients obviously want to get back to that hourglass appearance. So we usually need to combine these several techniques to improve the appearance of the abdomen. The typical tummy tuck consists of removal of the extra skin in the lower abdomen, repositioning and refinement of the appearance of the belly button, liposuction of the flanks and love handle area to help bring the waist in, and tightening of the muscle with internal stitches to also provide support to the muscle layer. Tummy tuck techniques have become more and more refined over the years to where we're now able to place the incisions very low to be hidden in swimwear or undergarments. The telltale sign of a really well-performed tummy tuck is a scar that's really hard to detect even in a two-piece bathing suit. Obviously, different patients have different anatomy, and some of these considerations vary from patient to patient, which is something we can determine better on a physical exam when you come in for your complimentary consultation. Tummy tuck surgery can now be performed as an outpatient operation, so we don't need to keep patients overnight or do these procedures in the hospital in the overwhelming majority of patients. Usually, the tummy tuck operation takes between 2 and 3 hours. The patient will go home after recovering in our facility. We'll see the patient the next day and guide you through the recovery process until you have a very nice outcome. Every patient we see for tummy tuck consultation will be introduced to one of our very experienced patient coordinators who will help guide them through the whole patient postoperative journey. I usually ask patients to take about 2 weeks out from work so that they can comfortably recover at home before returning to normal activities. To learn more about tummy tuck surgery, please visit our tummy tuck page at our website, timsyedmd.com. Thanks.